Hi, my name is Gurleen Kaur, and today I'm going to discuss two functions test with you. So the first is the near point of convergence, and the second is the confrontation field testing. So before doing any test, make sure that we have to disinfect our hands and tools that we are going to use while performing this test, and we have to introduce to our patient that what you are going today and what's the reason to perform that test, just to make sure that the patient is comfortable with us to every point. And we have to perform this test 3 times with the patient. And if the patient is good, if he or she doesn't feel anything double, then we have to record as TTN. And if the patient sees anything double, then we have to record the breakup point over the recovery point, and the which I got suppressed while performing this test and how much. These all are the things that we have to require to record while performing the near point of convergence test. So the second test is the confrontation field testing that we use to observe any unnoted visual field defects in patient's eye. So the equipment that we need is the occluder, and make sure that the patient remove their glasses while performing this test, and also make sure that the patient and the examiner should always sit at equal heights while performing this test. And we have to instruct our patient that they should have to occlude their left eye, and make sure that the examiner occlude their right eye. And we have to make sure that we have to instruct the patient that they should have to keep looking at the open eye of the examiner. And we have to tell them that we are going to show our fingers in different quadrants, in different 4 quadrants, and they have to tell us, and they should have to let us know that how many fingers they are seeing. And we also have to make sure that the fingers are in the middle of the patient and the examiner, so that they can also see. We don't have to go too far so that the patient can see the fingers. And we have to record the right eye fully and the left eye fully. And then we have, if there is anything missing in any quadrant, then we have to record according to the left eye or the right eye, and that which quadrant the patient is missing. And this is all about the confrontation field testing. Thank you.
The procedure of confrontation test, we make sure that the patient occlude their left eye first, as we always start with the right eye and then go with the left eye. The patient will occlude their right eye, and we ask the patient to look at the open eye and make sure that they keeps looking at the open eye and not the finger. And then we ask the patient that we will show you the fingers in different 4 quadrants, and they have to tell us how many fingers are there without looking at the fingers. We don't have to wiggle the fingers, or we don't have to move it. We just have to be clear with the finger in each quadrant. The finger should be in the middle of patient and the examiner. It shouldn't be like in the patient, in the examiner's side or something. And we make sure that the examiner sees the finger as well. If the examiner can't see that, it's beyond their field of vision. So it's hard for patient to see as well. So we ask the patient to cover with one eye, look at the patient examiner's open eye, and tell them how many fingers will they see in each quadrant without moving their eye. In the recording part, we always show the patients 1, 2, or 5 fingers. They have to tell how many fingers are they see. If they don't see any finger at all, then they have to let us know about that. If the patient sees all the finger in every quadrant, it should write OD full or OS full. And if there is any quadrant the patient can't see the finger, we have to make a note about that. Let's say the patient is not able to see the fingers in the upper right quadrant, so we write down OD upper right quadrant, or OS OD restriction upper right quadrant. Or the patient don't see left eye lower left quadrant, then we write OS restriction left lower left corner or quadrant. That's how we record the confrontation. It measures your patient's peripheral field of vision, how much amount of field of vision patient have in each eye separately.
Hi Allison, my name is Melissa. I'm going to be your student optician today. We're going to do confrontation field testing on you, which is to screen for unnoted visual field defects. So basically we're going to look for blind spots in your vision. I'm just going to take you to take your glasses off, please. Wonderful. And I've sanitized the occluder for us, and I've washed my hands. So I just want you to hold that up to your left eye first. Perfect. And then you are going to continually look at my left eye. I'm going to hold up the numbers 1, 2, or 5 with my fingers, and I just want you to tell me what number I'm holding up.
1, 2, 5, 1.
Perfect. And then I'm just going to get you to occlude your right eye. Wonderful. And then just looking at my right eye here.
1, 2, 5, 2.
Beautiful. Thank you very much.